CAR T cells, as the name says, is a chimera, is a T cell with an immunoglobulin on the surface. Well, we all know that it's the most exciting success adoptive immunotherapy has made at any time. In particular in lymphatic diseases with CD19 directed CARs. And well, that's where we are at the moment. We are, there have been some more CARs have been developed, for example, multiple myeloma. There are some studies ongoing in solid tumors. What we are still missing is a CAR effective for myeloid diseases. With respect to relapse prevention, we do not have so many data that have used CAR T cells as consolidation after allogeneic transplantation. The studies I have been showing use just the opposite approach, meaning CAR T cell as a bridge to transplant, or I can say allotransplant as a consolidation or maintenance after CAR T cell therapy. So that sequence, there are very promising data that allow to report on long-term outcome, overall survival, leukemia-free survival of 50 to 60% in advanced lymphoblastic leukemias.